a reinforcer that the students want, and you're going to have to be an actor most of the time. I have this putty. It belongs to me. Nobody can touch it. This is my special magical putty. And you cannot, this is mine, please. Nobody can have it. I'm going to keep it up here. And the student should not have access to your reinforcer at all times. That lessens the value of the reinforcer. It has to be exclusive. I love what you're doing here. This is amazing work. It has to be meaningful and desirable. If you are talking to a student, you cannot, they have to know that what they are doing means something to you. If you, the educator, are the reinforcer, you can't say good job. For some students, that's not enough. You have to be specific about the praise that you give so that the student feels like that means something, they enjoy that feeling that they're getting, and they want to get the feeling again. I really like how you solved this equation. What I'm seeing here is amazing. I want you to show everybody what you did. This is great work, and I'm extremely proud of you. You make eye contact, and it's meaningful to the student. So here's some examples of some reinforcement organized by the function of behavior. If the student is behaving, having a behavior, a challenging behavior, in order to get out of something, in your reinforcement plan, in your behavior intervention plan, the reinforcement could include free time. So the student should earn free time for the behavior that you need to see. Short breaks, a quiet area in the room. If you find that the function of behavior is escape, the reinforcement should be something that gives him escape. If the reinforcement is for attention, you should find a way to give that student attention for the behavior that you need to see in the classroom. Tangible items, stickers, gifts. Sensory stimulation, that's Play-Doh, slime, watching YouTube, watching something, looking at something that looks nice. I have students who are on the, who have autism, and they have high sensory needs. So sometimes a reinforcer for them is, it's sensory. They have sensory needs, so a reinforcer for them is a massage on the back, or a massage on the arm. That's reinforcement. A swinging is reinforcement for some students who are on the spectrum. Rule-governed behavior, that is recognition for certificates, recognition for higher levels of behavior. That's rule. If the function is rule-governed behavior, certificates and recognition for higher level behaviors is what you would give. So what happens when a child has a behavior? Let's go back to this, punishment. We all know that we don't punish. We're not supposed to do punishment, but punishment is a part of life. That is how we learn. We learn through punishment. Punishment is anything that happens that decreases a behavior. It's not necessarily you doing something to the student. Punishment is anything that happens that will decrease the behavior in the future. An example of this is if you put your hand on a hot stove, it hurts your hand, you don't put your hand on that hot stove anymore. That's punishment. That's natural punishment. That is how you learn to decrease the behavior. We should not be giving punishments in the sense of actions that we feel will decrease the behavior. Does everybody understand? We shouldn't be shouting, hitting, doing things that we want to decrease the behavior in an aversive way, but punishment is anything that's aversive that happens that will decrease the behavior. Punishment could be recognition of a student. Has anybody had a high school or middle school student where you say, come up here? I want everybody to see you. Come up here and show them what you did. And you have that student who's extremely embarrassed. They don't want to be in front of the crowd. They don't want to stand out. And you're saying, yeah, come up here. I like what you did. Tell everybody what you did. And I was like, yeah. And they walk away. That's a form of punishment, unfortunately. Is that student in the future going to do something else to get the same reaction from you? They're going to try to avoid doing that behavior if they have to do the same thing. So, stopping the behavior before it starts. This is the easiest behavior intervention, is an antecedent intervention. If the child wants attention, escape, tangible sensory stimulation, we stop the behavior, we provide them with everything they need before they have the behavior. They shouldn't have a reason to have a challenging behavior in the classroom because all of their needs are met. You will not see the challenging behavior if you stop the challenging behavior before it starts. So let me go back to the antecedent intervention. Antecedent interventions means your classroom is a welcoming place. It's a place where your student feels loved, where your student feels like they belong. It's a place where your student feels like they're at home. They get the attention that they need, so they don't have to have the challenging behavior to get attention. You're providing attention already. They are already well fed. They don't feel hungry. They're not rushing off to try to get a snack. They feel like all of their needs are met. You do not see challenging behaviors in human beings, yourself included, when your needs are met. It's only when some of those needs are not met when you will see people displaying challenging behaviors. Another way to change behavior is to reinforce an alternate behavior. You have two students. One student is calling out, one student is raising their hand. This is a simple diagram, and every teacher has done this. They've gone to the student and said, I really like. One student is calling out for attention. The teacher says, I really like how Sarah is raising her hand. What do you see? Everybody around them starts to raise their hand. I really like how you raised your hand. You give attention for another behavior. If you are going to reinforce an alternative behavior, you have to give the reinforcement as soon as you see that behavior happening. So he's saying, Miss, 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 Miss. Sarah, I really like how you're raising your hand. Miss, Miss. Sarah, if you do that, the student will go back to what worked before. As soon as he raises his hand, you need to turn around and I love how you're raising your hand. Yes. So that he knows this is the behavior that I need to display in order to get attention. So, we talked about reinforcement. I talked about my story about the stickers. There's been other reinforcement that I've used in the past. If you give too much and too much access, it will weaken the behavior. You have to continue to change the reinforcer. And if that means changing it to a higher level of thinking, from a sticker to a great job to I love the way that you're doing this, that's what you have to do. You cannot give the same reinforcement because excess will weaken the behavior. And I'll give you an example. We all want love, but has anybody been stalked? We want somebody to love you. You want somebody to like you or love you. But imagine being stalked and having somebody call you, 100 times a day, follow you around. You'll probably go crazy. You're not going to do whatever it is, the behavior that the person wants to see. You will change whatever behavior it is that you're using, that you're doing, that you're displaying, and you will not do it anymore if you see that that is giving you too much of whatever the reinforcer it is that you want. So that means you need to dole out your reinforcers in a limited way to continue the behavior, but not give too much. You cannot give too much of a reinforcer. So I'm going to open it up to questions about specific behaviors. And I know we have a lot of teachers who may see a specific behavior. I'd like to leave time now to, if you have a question about a specific behavior in your classroom, or that you've seen, please try to be as anonymous as possible, and I will answer questions about specific behaviors. Anybody? I'm sorry. This one? This one? Or? Okay. And any questions about specific behaviors? I have a person with a question here.
Hello, thank you for the nice presentation. I'm a year 1 teacher, and in the classroom we always face girls with needs. So how can we identify the function? Because these girls don't even know their own needs, so it makes it more difficult for us to identify it. So they will be like, I'm tired, I'm hungry, I'm sleepy, I want to go play outside, all at the same time. So it makes it more difficult for us to identify the function or the need in order to they intervene and solve the problem.
Okay, thank you. Identifying the function of the behavior is a process, and it starts with taking data, observing the behavior, and if you're the educator or the instructional assistant, you want to have somebody take data on the behavior. When is the behavior happening? What happened immediately before that behavior? And what happened after? So, an example of this, you develop a chart, and it could be a chart with 3 columns. It's called an ABC chart. What happened before the behavior, exactly what happened, and what happened after. I'll give an example of this. You have a student who is always hitting. On that chart, it would say at 11 a.m., when Rashid was seated next to Sarah, he hit her on the arm. Sarah said, "Stop hitting me," and started shouting at Rashid. Another student came over to Rashid and said, "Why did you hit her?" That's an example of what happened before, the behavior is hitting, and what happened after. You want to take data on however many times this is happening and what happened after. Then you look at the consequence of every behavior. If you see that the consequence of every behavior is the student is receiving attention of some sort from his or her peer, you will know that the function of that behavior is attention. If you have a student who is always taking something and the outcome is he gets to keep whatever it is he takes, you will know that the function of that behavior is to receive what it is that he's taking. So finding the function involves observing the behavior and taking data, looking at the data to see what was the outcome that the student received for that behavior. Yes.
I have an autistic boy, mild to moderate, communicates, but in the classroom he gets paranoid and always thinks the children are making fun of him or laughing at him. If anybody whispers, he assumes it's about him and starts screaming. What would I do in this situation?
Okay, so to me that sounds like it's a sensory issue. So one of the things, of course, you take data on the behavior. When is it happening and what's the outcome of behavior? Is it happening when other students are around coming whispering? And for this kind of behavior, you want to try to establish more relationships within the classroom. So whenever possible, you set up positive groups with the other students in the classroom so that he can get positive interaction from his classmates. You also may do, with students who are on the spectrum, you may want to do a social skills group or model different situations, either with toys or with other students, of classroom situations where you pretend like you're in a classroom with other students and you say, oh, this, if you're using toys or you're using other students, you may have a student whispering. Oh, he's whispering. What do you think he could be whispering about? What are some things you whisper about? Do you think it's always that someone is making fun of him, or maybe he's just talking in a light voice? You want to model, and this is important for students on the spectrum. It may not work for every student. So it's not just a conversation. Sometimes it may involve a social story or a social skills group. It depends on, and specifically for students with a diagnosis. If there is a diagnosis of autism, they may have to have this type of group in another setting. And I'm not saying outside of the school, but maybe a weekly or a bi-weekly setting based on the need of the student, of a social skills group where they're talking about how to develop social skills and social relationships in the class. If you're trying to just have a conversation, they may not get it. Understand? I'm sorry, one more question or no? One more question. I think this person right here.
Good morning to you. My
Good
name is
morning.
Deepthi. I'm actually pre-KG teacher, and in my class, 2-3 kids which we are supporting them autism and all also, but few kids are biting. I'm trying to help them the way you are telling, but I get some more advice from you how I can stop them biting each
Okay.
other. Thank you.
Okay, so biting, yes, we do see this with students with autism. Some of the immediate, since it is a harmful behavior that hurts other students, some of the quickest options is to give them something else to bite. And they have manipulatives that you can use, that you can give students so that they can use it to bite. They have necklaces, and they have, different tactile materials that they can bite, and it's safe to bite. You can ask if you have a special education teacher about ordering some of these things that they can bite so that they get the same sensation of biting without biting another student. You also need to separate that student, give them a social skills group on how not to bite, because the first priority is the safety of all of the other students. A quick intervention, and I know a lot of teachers don't like this, but there has been research to show that it works, is chewing gum. Chewing gum, a child chewing gum, yes, it may be annoying in the classroom, but it's better than a child biting another student. So you need to look at which is the highest priority. Do you want a student to get bit, or do you want to have a student chewing gum? And chewing gum is an intervention that you can use as long as you explain to the students, when you finish, you have to throw it in the trash room. You can't take it out of your mouth. If you take it out of your mouth, you won't be able to have it anymore. But chewing gum. I think that's my time. Thank you very much.